In light of the pandemic of 2020 and the digital technological revolution, healthcare professionals are faced with new decisions about how to cost-effectively keep their patients healthy. Let's look at the cold hard facts. Diabetes affects 10.5% of the population, or 34.2 million people. And with 1 in 3 over the age of 65 suffering from diabetes and its complications, this means that 61% of all healthcare costs for diabetes is in the 65 and older age group. This amounts to a staggering 16 million emergency room visits at a cost of $1,625. 224,000 of these visits are for hyperglycemia and 235,000 for hypoglycemia, meaning that existing day-to-day management tactics and goals are not being met successfully. This leads to countless hospital admissions, many of which involve the ICU. ICU visits cost $10,794 per day and can lead to more than $36,000 for an average stay of 3 days. Of the 7.8 million hospital discharge diagnoses, 1.7 million had cardiovascular disease, 130,000 lower extremity amputations, and the rest either had hyper or hypoglycemic crises. Overall, diabetic complications cost almost 1/2 to 2/3 of their total lifetime medical costs. Something has to change. The annual cost of diabetic medications exceeds $2,700, and every year, $35.5 billion is spent on equipment and supplies, accounting for 15% of the total expenditures, and a staggering $71.1 billion, or 30%, is spent for medications for diabetic complications. Besides the $237 billion in direct medical costs for diabetes care, there are lost productivity costs of $90 billion, with $24.7 billion in unnecessary, wasteful, and avoidable spending. Because 1 out of every $4 spent on healthcare goes to people with diabetes. From 2007 until 2017, there was a 60% rise in economic costs from diabetes care. The average office visit reimburses $69 so that glucoregulation can be optimized for a 40% reduction in retinopathy, nephropathy, and neuropathies. Visits for blood pressure regulation can lower strokes and heart disease by 33 to 50% and reduce nephropathies by 50 to 70%, also slowing renal decline by 33% with good blood pressure control. By lowering cholesterol, heart disease can be further reduced by 20 to 50%, and retinopathies and blindness by 90%. Regular foot exams and patient education can lower amputations by 85%. According to the National Committee for Quality Assurance, NCQA Medicare 5-Star Quality Rating System, Merit-Based Incentive Payment System, MIPS, and other national benchmark quality measures, diabetes care is highly dependent on self-management. Yet 50% fail to meet an HbA1c of less than 7.0, which leads to diabetes being the 7th leading cause of death. In a study of 26,000 people with diabetes over the course of 5 years, improving access to primary care can lead to a significant improvement in clinical outcomes, such that hospitalizations were cut by 59%, cardiovascular events by 57%, and mortality by 66%. This resulted in a $7,451 net per capita savings annually. With the CCM program, people can remain in their homes, enjoying their normal activities with friends and family, while their health is being monitored and analyzed from a remote facility, monitored by a physician who analyzes the physiological data collected. The system can detect glucose and blood pressure anomalies, generate alert signals in the case of an emergency, and perform analyses of long-term health trends. CCM's health mission is to utilize its patent-pending software technologies that are powered by artificial intelligence and machine learning, and decrease hospitalizations and 30-day readmissions, reduce mortality, and help patients under supervision of healthcare providers. Elderly Population Health Management to live healthier and happier lives.